perioperative medicine is the study of the decisions, the processes, the evidence and the practice of patients having surgery right from the time they decide to have surgery or are thinking about having surgery to the time they get better from surgery.
So perioperative medicine has arisen out of the advances in surgical technology and the changes in the adult patient demographic. So operations that would have been inconceivable even 20 years ago, such as removal of cancers from the liver and the lung, very complex stenting procedures to treat vascular disease, for example, those sorts of procedures are now possible and commonplace. And because of the nature of the diseases that they're there to treat, the types of patients that are undergoing these types of procedures are quite high risk, often aged, and therefore carry with them a whole bunch of comorbidities and problems that require address. So perioperative medicine, I guess, is about maximising the opportunity to improve patients' health and well-being from a surgical procedure to ensure that they don't get complications afterwards that might negate the positive impact of the surgery.
Well, I think perioperative medicine is the whole continuation of care from patients when the decision is made for them to have an operation right until they're discharged from hospital after their operation. I think with clinicians, especially surgeons now becoming super specialised, often the holistic care of the patient is overseen a little bit. And I think sort of the new specialty of perioperative care is where sort of encompassing patient care and improving their outcomes as a whole, as opposed to just from their one specific organ damage.
Perioperative medicine is undoubtedly caring for patients who are undergoing surgery. How does that differ from the traditional model of anaesthetist, surgeon and physician on the wards? Well, I think the difference here is that the process of care of the patient undergoing surgery is a joined-up process. It is run, orchestrated and delivered by someone whose expertise, skills and knowledge are in the outcomes and care for patients in that perioperative period. So it's a holistic approach to caring for patients before surgery is contemplated, right through to that period of ready for discharge. And some would say, in fact, it extends into the community to look after patients with their GPs in the time after surgery.
Well, anaesthesia is perioperative medicine, and perioperative medicine is anaesthesia. And what do I mean by that? It's just recognising that the anaesthetist has an extended role outside of the theatre, of the operating room, the provision of anaesthesia per se, which includes preoperative evaluation, truly informed consent, and afterwards the extended role with regards to surgical intensive care, pain management, all the way through to the patient being ready to return home in a healthy, happy state. And that happens much of the time already. It's just clearly recognising that if you are an anaesthetist, you are a perioperative physician.